So in this year of environment, it's important that we understand the benefits that the environment can do for NHS and for social prescribing in particular. So the natural environment has huge therapeutic effects. We know that if you're outdoors in a park, your blood pressure will drop and your pulse rate will drop, and even brain waves in the kind of cortex actually start to change. You start to get alpha waves, which are the kind of rest calming, and that can all happen just in a few minutes of being outdoors in a natural environment. But it's more important than that. If you're in a very deprived area and you've got lots of stresses in your life, and it could be from bullying at school, it could be just poverty, it could be from fear of crime in a natural environment and where you live, if you are indoors all the time, you will actually find that you don't have that relief stress anymore. The stress levels build up. If you're outdoors in nature, it can actually affect and help you actually cope with the stress. And therefore the chronic stress, which is very common in the more deprived areas where there's crime, that calms down if you've got that connection to nature. And because of that, you get a lack of inflammation as well. Inflammation drops down. That's the immune system when it turns against itself. And then from then, you start to lose the benefit of the problems of depression, dementia, and anxiety, and then even diabetes and obesity. So there's this problem that we've got of people being indoors where they don't feel a sense of place, they feel isolated, particularly children. And what we have to do is to connect them to outdoors where they feel comfortable, where they feel that they don't feel intimidated by the outdoors and there's no fear of crime. The parks are welcoming. You've got people doing conservation work, understanding what nature and the part it plays. And that has a huge effect, we know, on that community and population, which eventually leads to the reduction of the diseases that we've seen increase, the diabetes, etc. So this is a turning point, I think, where social prescribing can start to use the natural environment for that therapeutic effect. I think all of us, whether we're medical professionals or patients, in fact we're all patients because I'm a patient as well, but everyone should start to try and get that 20 minutes every day of some connection to the natural environment. Where we live, just around where we live, taking notice of the trees, taking notice of the parks, taking notice of those little green spots we've got, and even if you're lucky enough to have a garden, taking notice of what's in the garden. Because if we start to reconnect, we'll start to see that change in our own attitudes, and we can start dealing with the stresses and strains. So 20 minutes every day, taking note, and if you can only do 10 minutes, that's better than nothing.